I will offer it. You just read. Okay. నాకేవి రాదు ఇంత మనల్ని జాయిన్ అవ్వమని చెప్పాను అందరికి. ఆయన గురించి రాసుకున్నట్టు అటు ఇటు చూడకూడదు.
Ma'am, we are good to start.
Hello everyone, welcome in today's nursing webinar quiz session. Myself Shanti, and today in quiz we will be having 3 rounds which will consist of 12 questions only for half an hour. And let us see who we have today in as a quiz host, Miss Bijali, who is from Education and Nursing Education and Training Department. I welcome you, Bijali. And
Thank you, ma'am.
Before we request all the participants to do download the Kahoot app and enter your game pin, which is displaying on the screen, which is 9340481, and just prepare yourself and be ready to play. Over to you, Bijali, for the rest of the quiz session.
So good afternoon, everyone. So I am Bijali, nurse educator. So as we know that we have a Kahoot app. So here you have to log into the Kahoot app. The game pin is 9340481. And via Facebook, you need to place a comment. That is of 4 options. You need to place a comment. Okay. So we have seen on the boarding, there is about 11 participants. And I request you to join as soon as possible. So it is interesting that many of the people are coming. And let's begin.
Bijali, shall we wait for a minute or so that, many more can join us?
Yes, ma'am. Yes, ma'am.
By then you can just read the names. I think they are all from
Yeah.
Yashoda and other
So
units.
I have seen here on the board MN and Shireen, Bintu, and then Yedu Krishna and Akhila, Abhisha, Seema, 5th A, Bebo, Shona, Dared Evil, T. Swati, and I think yet more to join over here. Only 15 participants, Dhana, Suji, Lata, Betty, Chini, MN, and then only 16, Linta, Elsa, Thomas. Yes, more are invited. Now the participants are 16, now has been increasing. So it is about 17. So Raju, welcome on the board. So Shalini, and then Sherin, yes, Joshua, and then total participant I can see about 20. The score has been increasing. Pathan, yes. And now it is about 20 participant I can see over here. Many
please
more
make
can
it full
join.
screen?
Yes.
Please make it full screen. Right corner, you will find a box there. Right corner down.
Zoom
Just
your
click
full
it.
screen,
Yeah,
Bijali.
Yes, ma'am.
done.
So I
Done.
can see about 21 participants on the board. 22, it is increasing. That is Ravali came up. And then many more can join. So we want an increasing number.
Then
Yes, come on.
Somebody by name
Tara?
Devil.
Yeah, Devil, Sujata, Amani, Bingi. Yes. Now the participant score has been increased. That is about 24. Yes, Angela. Then we have about 24 participants on the board now.
Until
Yes.
then, would you like to just discuss about the rounds, Bijali?
Yes.
Till they join and we give them few minutes.
Yes, ma'am. So we are having about 3 rounds. Okay. And then in 3 rounds, we have like 4 options. So we'll be playing 1 to 1, one after other, we will play the rounds. Okay. So yes, we also have joined the Priscilla, and we have about 25 participants over here
And
presently.
again, you can repeat the Kahoot instructions with the game
Yeah.
pin. It will be
And as soon as see already Kahoot app, you people have to join, and then you have to pin code is about 9340481. Via Facebook also you can join and share the comments over on the Facebook, and keep your options over there. And now we have also Pinky on the board and Bhavani also. So I request you people to join the Kahoot app as well as the Facebook. Via Facebook you can join. So I can see about 28 participants. So all are enthusiastic to join over here. So Bhavani is on the board, Pinky is on the board. So around 27 participants you can join. So yeah, Amni Bigri also joined. So about 27 participants. And the game pin is 9340448. Kavya, Minsu, yes, welcome on the board. We have about 28 participants. Next, Sherin. So about the count has been increased about 30. And then you can join through the pin. That is 9340448 via the Facebook link. Now it is 30 on the count. As all, we are inviting you. So as soon as you can join the links.
You all can play in a group as well. Again, we repeat, either individually or you can participate in the group as well.
We can see here also Veera Babu came up. So, and also we have about 32 participants right now. And we have again a pin that is 9340448. 9340481. Yeah, now the total is 36 participants have been joined. So Farsana also have came up with Amni. So now the pin is 9340481. Via the Facebook link also you can join and keep the comments over in the Facebook as an options. So now the score has been increased. So it is 37 to 38. It has been increased. So participants have been increasing from the 37 to 38. So it has been, it is very interesting that you people are participating. So good. So the count, we are expecting you to increase the counts as soon as. So Vani, next we have Nani. Yes.
So shall we begin,
Ishwari?
Bijali? We'll
Yes,
begin
ma'am.
then? Yeah.
Yes, we can begin the game. Okay, so here we are now playing 18th Nursing Pro Quiz. So we have 3 rounds now. So in 3 rounds, we'll be having that is secrets to win the game. So here, eliminate the wrong answers first, select the right options, check for the multiple select and double points. Most vital is the fastest finger first. So here, as we have told you, that is 3 rounds we have. So round 1 is poem, procedure and post-operative procedure. Next, round 2 is the Monsoon, Menace, tips and precautions. Round 3 is optimizing IV patency, practical tips. Next, moving on to the rounds. So all are interesting. So we are in the round 1, that is poem, per-oral endoscopic myotomy procedure and post-operative care. So here is a quiz. So let's begin with the quiz. So I hope that all are finding interesting. So first question is, what is the primary, what is the primary
Indication.
indication for the poem procedure? So we have options like, first is esophageal eclasia, second is the gastroesophageal reflux disease, peptic ulcer disease, and irritable bowel disease. So 37 answer. So right option is esophageal eclasia. So next, see the scoreboard. So here we are having the scoreboard. So first top on is Shona. Next we are having Pinky, and next one is the Akhila.
Yep.
So we have here ration. So main reason for doing poem procedure is esophageal eclasia, when food and liquid is not passed into the stomach. So let's begin with the next question. So here is a quiz. So the question is, which of the following is an important pre-procedure instruction for a patient undergoing poem? So we have options: NPO, increase the fluid intake, take medications, consume a high fiber diet. So we have about 9 seconds. 33 participants have answered. 5 seconds left, 4 seconds left, 3 seconds left. And we have 1 second. So it is almost done. So the right answer is NPO. So let's see the scoreboard. So here we are having Shona on the top, good. So keep going. And Abhisha on the second, great. Next, Suji on the third. So keep doing it. So here we have like rational. So ensure the patient is on NPO, helps reduce the risk of aspiration and prepares the esophagus for the procedure. So next we see the next question. So here we are having the quiz. So you have to do a multi-select. We have the double points for that, so that you can win the game. So which symptoms should be closely monitored in post-poem patients? So here we are going with the 4 options. So first is chest pain, next is hypertension, next is the bleeding, and next is fever. So you have only 9 seconds left. Faster fingers wins the race. So we have only 26 have answered over here. 3 seconds, 2 seconds, 1 second. Okay, and the right option is chest pain and bleeding. So let's see the scoreboard over here. So here we can see Shona again on the top, and next is the Sherin and also Angelina. Thank you. And next we can see the rational. Monitoring for chest pain and bleeding may be observed as potential drawbacks post-procedure. Let's move on to the next. So here also we're having quiz. So that is the question is, what position is recommended for a patient during the immediate post-poem recovery period? So here also we are having four options. That is semi-Fowler's position, supine position, prone position, Trendelenburg. So let's answer. We're having only 10 seconds and 39 have answered. 7 seconds, 6 and 5, 4, 3, and then 1 second. Let's check. So we are having the answer of semi-Fowler's position is the correct answer. So let's see on the scoreboard who have answered correctly. So first is we are having Shona again. So claps for Shona. So keep going. Next is we have Shireen. Okay, and then the rationale we have behind it is keeping the position in semi-Fowler's position helps prevent aspiration and allows for better breathing. So let's move on the next question. That is on the round 2. So we have finished with the round 1. Next to the round 2, the monsoon menace tips and precautions. So here is a quiz again. So what is a common health issue during the monsoon season that nurse should be aware of? So here are the options. So first is dehydration. Next is heat stroke, waterborne diseases, frostbite. So we have only 22 have answered. So we have 11 seconds. Now as timing's running out, so you have to keep going and keep the finger fast so that they can win the race. So here we have about the answer is, that is, we are having about waterborne diseases. Okay, so next we can see the who has stopped in. So here we can see again, Shona came up. Next is on the Sherin. So born with Sumant Sherry. Next, the rationale is identifying common health issues such as waterborne diseases, example, diarrhea, typhoid. Help nurses prepare during the monsoon is important. Okay, next is again a quiz. So here you have the double point. So please ensure and play carefully. So this is the question, which preventive measure is essential to reduce the risk of mosquito-borne diseases during the monsoon? So here we're having the 4 options. Using mosquito nets and repellent, first option. Next is the increasing outdoor activity. Second is the wearing short sleeves. Next is taking the OTC medications. So we have only 3 minutes left. 47 have answered. So first is the answer is using mosquito nets and repellents. So let's see the scoreboard. So here, Shona is on the top, good, and Sherin also second. So keep going. Suman Shreti again on the third. So here is a rationale. Using mosquito nets and repellent is crucial to prevent the diseases like dengue and malaria during monsoons due to increased mosquito breeding. Next, see the other quiz. So here we have multi-select options. So you have to carefully monitor and select it. So what dietary advice should be given to patients to avoid the gastrointestinal infections during the monsoons? We are having options of, first is eating raw vegetables. Next is drink only the boiled purified water. Next option is avoid consuming outside food. And the last option is increase the dietary intake. So we have going with 4 seconds and 27 have answered, 29's answer. Let's see the option that is, we have to go with the drink only boiled water and avoid consuming outside food. Okay, now let's see the scoreboard. So Shona has come up, it's great going, keep it up. And then Sherin on the next and Shravs on the third. So you'll be doing the great things, keep effort. Next, we are having the rationale here, advising patients to drink only boiled and purified water and avoid consuming the outside food helps GI tract infections, which is common issue during the monsoon. So next, see the other one. So here also we're having a quiz that is multi-select. So the question is, what is an important hygiene practices to prevent the fungal and viral infection during the monsoons? Let's see the options. First is wearing the damp clothes. Next option is keeping skin dry and clean. Next is frequent hand wash. And next is a walking barefoot. We have seen that only 15 answered and 8 seconds left over here. So faster fingers wins the race. So keep on doing it. So and 1 second is left over, 36 have answered. So answer is here, keep skin dry and frequent hand wash. So let's see on the scoreboard who has won the race. So first is again, we can see Shona on the tape, claps, Shona on the board. So it has been going great. So keep claps for Shona. And next we are having again Sherin. So she is also going great. Next we have the Sumant. So here's the rationale, keeping the skin dry and clean and hand wash is essential to prevent the fungal and viral infections during the monsoon. So let's see again with the round 3. So in round 3, that is optimizing IV patency, practical tips. So here again started with the quiz. So the question is, what is the recommended technique for flushing an IV line to maintain the patency? We are having the options like, first is using a rapid push method, next using the push pause technique, next we having the flushing continuously for 5 minutes, and next option is not flushing at all. So here we can see 45 have answered and 6 seconds left over here. So as fast possible, keep it and do it. So we are having only got the answer, that is using the push pause technique. So that is the right answer. And next we can see on the scoreboard, again, Shona has reached. So claps for Shona, keep growing, and it's very good. So next we are having Sherry. Next is the Ishwari. So we can see here rational, using the push pause technique creates turbulence within the catheter, helping to prevent occlusion and maintain the IV line patency. And next we can see the other question that is on the quiz. So how often should an IV line be flushed when it's not in continuous use? We can see here again 4 options. So every 24 hours is the first option. Next is every 4 to 8 hours. And next is once a week. And last option is only when medication is administered. We are seeing here 45 answers. Only 6 seconds is left. And we are seeing only 2 seconds have been left. The right answer is the option is 2. That is every 4 to 8 hours. Let's see in the scoreboard. So here we can see again Shona has came up. Good, Shona, keep it up, keep going. And next we can see Sherin, also great work is doing. And next one is Ishwari. So here the ratio is regular flushing of the IV line every 4 to 4 hours. And when not in continuous use, help prevent blockage and ensures the line to remain open for medication administration. Okay, so next see the other quiz. So here also we have a multi-select and we have to select on 4 options are there. You have to select one. So which solution is typically used to flush an IV line to prevent the clotting? Again, we are having 4 questions. So keep going, keep doing. So first is normal saline solution. Next is sterile water. Next is a heparin flush. And next is antibiotic solution. So we have seen here on the board, 44 have answered. 4 seconds left over, 3 seconds. Next is a 2 seconds and 1 second has been left. So I have seen here that normal saline solution have been used and heparin flush has been used. That is the right answer. So next see on the board, we can see again Shona has come up. So that is great effort you are doing. Keep going and keep doing it. And next we can see on the serial, that is on the next, and Bintu on the third. And here is the rational. So we can see normal saline heparin flush solutions are commonly used to flush the IV lines. It helps maintain the patency and prevent the clot. So other quiz again, one more question. We have the double points over here. So be carefully play and do you win. So what should a nurse do if resistance is encountered during the IV flush? We have about 16 seconds left. Options are apply more force. Next is stop and assess the IV site. Next option is change the patient's position. And last is continue the flushing continuously. Flushing slowly. So 4 seconds, 3 seconds left. 49 have answered over here. So yes, so we can see over here, the option is B, stop and assess the IV site. And let's see the answer. So here ratio is if resistance is encountered, stopping and assessing the IV site is crucial to identify any potential issues such as clot or infiltration. Congratulations to the winner. So every Thursday you have FB Live at 3 p.m. Okay, and the winner should take a selfie with the quiz and share in live with the Facebook.
So we have come to the end of the session and let us see who is on the top score board. Yes.
Yeah, Akshay on the top 3, and we can see Sherry in the top 2, and top one is we can see Shona. So congratulations, Shona, to be on the top. Next is Sherin and Akshaya.
Yeah, congratulations to all the participants who all have participated in today's quiz session. It was an amazing session, and thank you, Bijali.
Thank you,
we
ma'am.
keep getting all the help from Education and Training Department all the time. Thank you, Bindu and
Thank you,
Katusha
ma'am.
as
Thank
well.
you, Bibla, ma'am, and also Shanti, ma'am, for giving an opportunity for a quiz.
Thank you. And we would like to request all the participants that every month, 4th week or 5th week of every Thursday, we do this quiz, and kindly do participate and gain knowledge and we end the session. Thank you, Bijal.
Thank you, ma'am. Thank you.